Thing.
Yeah.
Hey everyone, welcome to another episode of Darshan Talks. We have a special guest. We have Dr. Falgun Choksi, and he is a physician and a businessman who actually works a lot in venture capital and the like as well. And I'm going to let Falgun introduce himself before we talk about our topic today. Falgun?
Sure. Thanks a lot. Thanks for having me, Darshan. I was excited about doing this when you invited me. Hello to all the listeners and viewers. My name is Falgun Choksi. I'm actually a physician by trade, but I also do investments, I guess, on the side for now in the biotech and medtech spaces. I do have a very keen interest in the area of space commercialization and seeing how technologies that we have here on Earth can be used for that purpose, and then vice versa as well. I'm particularly interested in how humans can actually safely go to space, and my background in radiology and some of the investments that I've done in the biotech space, I think puts me in a pretty interesting position to give some different perspectives. So thanks a lot for having me on.
This is going to be really interesting because right before we start talking a little bit about space health. And that's such a wide topic to most of us. What does space health even mean? Before we get into like some of the basics.
Yeah, so it's interesting because it's something that most people don't obviously think of on the day-to-day or the week-to-week. And but a lot of the technologies, just in general, even without health, just in general, a lot of the technologies that we use on Earth, from our smartphones to just radial tires to freeze-dried foods and your frozen dinners and all, like, things that are very commonplace in society nowadays. All those technologies actually came from space technologies and space exploration. NASA has actually made a huge contribution in that front over many decades. And the reason space health is an issue is that people may think that, well, what does that have to do with me on Earth here? Well, the reason it's important is because a lot of the technologies that can be developed or have been developed in the setting of medicine and space medicine have particular uses on Earth. So an example is a newer technology would be the use of particular types of high-frequency ultrasound to break kidney stones apart without having to do any kind of interventional procedure. And this technique was actually developed in space. And the reason why being, when you go to space, we tend to have bone loss. And when that bone loss occurs, our calcium levels in the blood go up. And when they go up, you have a higher chance of forming kidney stones. So the interesting thing is that even though the technology was developed out there, its use on Earth, because kidney stones are a very common ailment for a lot of people, it can be used, pretty much anywhere on Earth. And it's a very low-cost solution, actually. So space health sounds like a very kind of, no pun intended, but like a pie in the sky type of idea. But I think the importance of it is that with the advent of lower cost launches being able to be performed by companies like SpaceX, what ends up happening is that now we can actually go out into space in near what's called low Earth orbit, and we can commercialize technologies that have both spacebound and earthbound applications. And I can discuss some of that with you.
Tell us a little bit about some of the recent spacebound or earthbound applications that we're already looking at.
Yeah, so one of the first things that was actually looked into is is actually in the fiber optics industry, where fiber optic cables can be developed in a much higher sort of quality and a higher how would you say, a solid crystalline structure than they can be on Earth. The interesting thing about that is that can be used both in space or space-related exploration, and also on Earth, such as with the fiber optic cables that run, along the floor of the Atlantic Ocean in order to get us our internet globally. On the health front, interestingly, pharmaceutical applications are an area that has already received funding in order to be done. So a lot of major pharmaceutical companies have leased time in the International Space Station on the the laboratory portion of it in order to see what are the effects of microgravity. And the interesting thing is that even though the laws of physics don't change in our macro environment, the effect of gravity is a very significant force, not just for us as biological systems, but also for non-biological systems, such as these fiber optic cables and whatnot. But the cool thing about in the pharmaceutical industry is that there are certain medications that can be developed higher quality actually in space, and that technique then can be scaled, and then the medication can be brought back to Earth. And the interesting thing is that the reason why is because you don't have these issues in space that you have on Earth, namely, let's say, heat convection currents. You don't have like the effect of gravity, messing up like a layer system where heavier things will now go to the bottom. And the cool part about that is that it may sound like, oh well, this sounds so expensive. This is just going to make the price of medications and technologies more expensive. The funny thing is, it's actually not as expensive as you would think. And the trade-off for the quality and the efficacy of having these things work is actually pretty high. And there are companies already working on making factories in space for these kind of things. So as with any industry, once you can reduce the unit cost of a particular product, through economies of scale and larger manufacturing practices, now all of a sudden you're able to bring down that cost. So I think what we're going to see over the next probably 10 to 15 years is we're going to see more commercialization funding go into space, and we're going to see that effect of earthbound technologies now becoming improved or new or further disseminated.
So we're already getting some interesting comments. We've got some people talking about better development of pharmaceuticals in space, and they're excited. So that should be really, really exciting. Here's a question for you, though. Mm-hmm. We're talking about bringing high-frequency ultrasound from space back to Earth. We're talking about building factories in space. But isn't that a little premature in that do we need, for example, IRB approval to do studies for patients who are in space? Or do we say that that's the practice of medicine, and therefore you don't actually need to get IRB approval? What's your take on that? How has it been handled?
Yeah. So I think, as with a lot of things in space, it's a frontier perspective. Like you're going into another frontier, and the cliche always is space is the final frontier. But in a way, it is, because it is boundless. Like we could travel for generations and generations, and we would never even get out of our own solar neighborhood, so to speak. So what I think is that what historically has happened is essentially these astronauts that have gone up, either as part of Russian missions, United States missions and whatnot, they essentially sign over their consent rights. So they say, okay, we go up there, you use our bodies to test us out for different technologies, different methodologies. And what ends up happening is that then you get like that proof of concept going. So the ultrasound is a good example. Now when it comes to like saying that, okay, do we have any kind of indication that, let's say, the FDA has to approve, or that a governing body has to approve, and for that you need a clinical trial? Yes, you can do a clinical trial, but the issue is going to be your sample size, because right now the sample size is pretty small up in space, right? You only have a handful of astronauts there at any given time. The lay public, although more people from the general public are being chosen as astronauts, which was, it just happened this year. It's not the same thing as what we see in science fiction movies or science fiction shows, where you just get on a ship, a rocket ship or something, and you're just taking it just like a bus, like you would take a bus from one place to the other. So I feel like there will be a role for IRBs, but I feel also that because space is not any one country's sovereignty, right? It sort of is like, well, it depends on who's doing the research. So the thing about IRBs is, yes, it is good. I think it is good to take a step back and know what you're doing. but you don't want the IRB or other regulatory sort of systems to essentially be the bottlenecks which dissuade particular countries from developing technologies, which then another country with less regulation will just go ahead and do. So I think there's going to have to be a little bit of a change on how expeditious IRBs are, because they tend to be very slow in general.
They do. But here's the question then. Do we land up in a scenario where we say we'd rather be fast and nimble, but potentially unsafe, than be slow and constructive, but safer? And that's the balance that hopefully IRBs are providing.
Sure.
And from a bioethical standpoint, I would wonder if that translates. For example, we land up in a scenario where we say, oh, you know what, these processes slow us down. Why do we have them on Earth at all?
Mm-hmm.
So what is your take on that? How do you think that as we start exploring space, are the rules we follow on Earth start changing?
That's definitely a possibility, and I think that's a good point to bring up. Is that, more often than not, a lot of the problems we face on Earth, as far as sort of just getting things done, are because of bureaucracies that have been built up. And the IRB is just another bureaucracy. It started with a good intention. It started with a good, ethical premise and whatnot. But as with many things that have been institutionalized, it now has a very bureaucratic feel to it. Right. Now there are private companies that function as IRBs as well, and they tend to be a little bit more faster in getting the approval done. And because they have a vested interest, because the researcher wants to get things going, and they sort of cross all the T's and dot all the I's for you, so to speak. And I feel like that will be a better probably way, or a more desirable way to go. So if you're a company and you're dealing with something that has to do with biologics or some type of a treatment sort of regimen, and you're developing it out there in space, I feel like you will look for the shortest path to commercialization, because at the end of the day, there's real, there's money behind it, there's time, there's resources, and the people who are going to commercialize space don't have the luxury of sitting around and do the glacial pace of academia, which tends to happen. And so the way I look at it is, I think it should be more fast and nimble, but I think there should be some oversight component, as long as it does not stagnate what is going on there, because it will be like the frontier that the best analogy I've heard of from people who understand this space better than me is, it is just like when we were basically in the United States, back when the frontier was being explored from east to west, and people were sort of staking their 40 acres and going for the gold rush in California and Oregon, and there was some level of lawlessness, so to speak, but there was also a lot of sort of pragmatic innovation that was done, and the people who made the shovels and the picks were the ones who came out on top, such as Levi Strauss. So I feel like these things with regulatory bodies are important, but I think that regulatory bodies will have to loosen up the process component so that they actually just get the job done, as opposed to making people get into a bottleneck. And the FAA, actually, which is actually the governing body for anything going up into the atmosphere, the FAA has aligned with a lot of private sector companies and private sector momentum in order to make a lot of this facilitation happen. And sometimes what happens is you have one government agency that all of a sudden gets efficient, and you may have a ripple effect from that. So what I would hope is that the FDA would get on board, the IRBs would get on board, because I can tell you, people are not going to just wait. If someone says, okay, this is US based, okay, fine, we'll go to Croatia, where they don't have as many regulations. China does their own thing, frankly, and at some point it's just gonna become the new arms race between companies.
So here's my question. Now, okay. You raised this very interesting idea of people will go down their own paths. I have to respect the fact that I don't know much about this. at this moment, and I'm going to promise you that I'm going to learn a lot more very quickly, because this sounds very
Yeah,
exciting.
it's a niche space. Let's put it that way.
Yeah. So here's my question. I've always understood the International Space Station to be a very cooperative body. There are a bunch of different countries that came together. I know China has its own, is looking at creating its own space station. I don't think it's live yet. Last I heard, but I know obviously SpaceX will probably start considering something like that as well.
Mm-hmm.
Do you see a future in which you have Kaiser space station and a Pfizer space station, where they're doing clinical research or non-clinical or preclinical research
Mm-hmm.
that's dedicated to them? Do you see a quote unquote pharma space station? Because
Yeah, so that's actually something actively being worked on, in the sense that what's happened over the last probably 7 to 8 years, probably 10 years now, is that on the United States front, the NASA, which is the governing body essentially, for aerospace in the United States. What NASA has done is they've divested themselves from a lot of internal capital intensive projects, and they say, well, now we're going to shift the risk. So it's a de-risking sort of initiative when it comes to the what they're doing with public-private partnerships. So SpaceX is actually the best example of this, and a lot of people are not aware that the only reason SpaceX actually exists and is this successful is because of significant support, both financially and also intellectually, by NASA. And the way they do that is via these SBIR and STTR grants. Mm-hmm. And what's up happening is essentially this is taxpayer money that is used for particular initiatives that are mission critical. And one of the mission critical things was, okay, we want to bring down the launch cost in order to facilitate cargo and other materials being sent up into space. Well, that's been the most prohibitive part of the equation to get stuff into space, is how much does it cost per kilogram, basically. So because of NASA's sort of infusion of capital and talent, and in conjunction with SpaceX's ambition and engineering prowess, what happens is now we have reusable rockets. So that's a huge leap. It's historic, and no one's ever done this before. But the thing is that this is taxpayer funded innovation. But this is innovation that actually has significant ramifications. So what I feel is that the more the public partnership sort of scale goes to the private part, the private partnership, you're going to just see more things out in space. So, for example, the ISS is set to be decommissioned in a few years. So it's just going to be completely taken out of commission. All the countries are going to leave their particular modules, and essentially, most likely, they're going to let it burn. They're going to dismantle parts of it and let it burn up, or take certain parts away. So what happens is, okay, so what do you do out in space? How do you do research? Private companies. So there are private companies that are trying to figure out, okay, how can we set up a lab in space? So the same way you have these smaller biotech companies in the U.S. or abroad. So Moderna is a great. Moderna is a great example. Moderna was a biotech company that had nothing to do with vaccines until all of a sudden COVID came around. Right? That wasn't even what they were about. And then all of a sudden, they're now focusing on vaccines, and now they have one of the 2 FDA-approved vaccines in the United States already in circulation. So you can imagine a company like Moderna says, you know what, we will either pay to develop basically a low Earth orbit lab where we can test other medications, vaccines, et cetera, up there, or a third company, just a third-party company, like a startup, will say, we will set up a lab. We'll have state-of-the-art equipment, so it's a high capital cost, but we will rent out the space and time to the rest of you pharma people. Yeah. So if you think about it from a de-risking strategy, right? So if you're Moderna, if you're Pfizer, if you're Merck, if you're all these big companies, you're like, you know what? It's the same mentality as acquisitions. Why should we build it when someone else can take the risk of building it? If it succeeds, we'll buy them out. Right. So in space, what you can do is you essentially is you rent your real estate, you rent your resources, and it's the same thing. You make the shovels and you make the picks, and you make your fortune that way. So if anyone's out there listening and they're thinking like, well, how can I make a space startup? make the startup where you can get recurring revenue. The business is not that different than the business thinking is not that different than Earth.
What I think is really interesting is a lot of big pharma has actually gone the other way as well, and they've started creating these incubator type organizations. Johnson & Johnson has J Labs, for example.
Yeah.
In those scenarios, you have a bunch of pharma small startups working in their space. And while you talked about a third-party organization where big pharma can rent space, it could go the other way as well, where big pharma creates the space and rents it out to little pharma. And little pharma develops on those sites, and maybe big pharma gets the right of first refusal, or they don't, and they provide just rent and access to innovation. So we don't really know where this will go. But here's another question. I was thinking, we've got a situation now where one of the largest costs you mentioned not that long ago was getting to space, getting to low Earth, if you will. We've been hearing about space elevators for a long time, and the biggest problem so far has been the cost of just how do you even get the base to support the weight of the elevator as it gets into low orbit. And people have been talking about carbon nanotubes, and they've been talking about some of these other innovations. Has there been any research done? Because the moment you get into a situation where you can construct in low orbit and the carbon nanotubes get us there, you have true capability to not just do research, but actually start doing manufacturing and then bringing it back down. So has there been any consideration that you're aware of doing research in that context?
Yeah, well, the space elevator has been an idea that's been around for a long time, and it's funny because it's really a misnomer. It's not a space elevator per se. What it really is it's a very high tension rope-like system, like a tensile, with a lot of tensile strength to it. Well, the interesting thing about the space elevator idea is that there's a lot of variable that you have to figure out how to control for. So, the regular atmosphere, any changes in atmosphere, how strong this cable basically is going to be. Is it going to be a modular system? So is it like, are you suspending the cable via some type of a propulsion system so that it just grows onto itself as the object that's being taken up or down? It does that. Others ideas have been you actually start in space and you grow it down instead of on the ground and you grow it up. I personally believe that I don't think space elevators are the best way to do it. I still believe that if you can drive down launch costs to less than about $200 or $200 US per kilogram, if you go lower than that, you have a significant value proposition for companies and governments to say, okay, you know what, we're going to use this particular vendor or this launch company and send our stuff in space.
Why that number?
Sorry?
Why the $200?
Because that's the number that's been sort of posted as, that's when we can get an exponential burst of commercialization activity. Right now, I think SpaceX is roughly like maybe $2,500 or $2,700 per kilogram. So, 200 would be an order of magnitude, obviously less than that, but they would have to ramp up the number of launches per day to like multiple per day. And,
right.
And it's, and so that's what they're trying to scale up this stuff right here. The issue with, manufacturing is it's probably easier to be able to manufacture right in space itself with actual floating factories in space, and then basically send the stuff back down. So you can take, maybe raw materials, certain supplies that you need, send them up there. But the other aspect of it is if you can mine other areas, so if you can mine the moon, let's say, if you can go to the moon and you can mine, the regolith, which is basically the soil that the moon has, and you can mine that and you can take out particular elements that are very, very useful for particular types of industries, then you don't have to transport it, up and down through the Earth atmosphere. You can go what's called a cislunar orbit between the Earth and the moon, and you can have a transport system like that. So now you say, okay, we don't really need the Earth for 100% of our supplies.
Right.
Now, this is obviously not going to happen overnight. With any ecosystem, it takes time to develop that ecosystem. But I do feel like because the launch costs are coming down and because there's a significant private sector interest and push to commercialize space, I feel like that's just going to catalyze over the next few years. And there's a lot of money. $9 billion have been poured into space commercialization companies over the last few years. And I mean, it is serious money that's going in.
But the question is, what have we seen as a result of that $9 billion?
Well, one of the biggest things you've seen is SpaceX actually driving down, reusable rockets. Blue Origin, Jeff Bezos sort of funds it out of his own pocket in a way. But you have other companies like Virgin Orbital, and Galactic, and they're trying to make essentially tourist-like flights where you can go for 5 minutes of weightlessness and then you come back down, which are essentially orbital, suborbital flights. And what we have seen from that investment is really launch technology advances. The other advances we've actually seen is what are called CubeSats. So these little satellites, which is where, like, for example, Starlink, they're deploying thousands and thousands of satellites. And instead of the satellites being in what's called geosynchronous orbit, which is where the bigger satellites, the telecommunication satellites are, which is a much farther distance from our atmosphere, these are on the lower end of low Earth orbit, and you need thousands and thousands of them in order to basically make this blanket around the Earth. And those are the kind of technologies you're seeing more and more. Launch technology improving, CubeSats, coming into play for telecoms, and then you're also going to get a lot of semiconductor work done in space because of the high fidelity of the work that can be done. Pharmaceutical, work being done in space, fiber optics, and there's a few other, categories that can be done. And as far as humans go, as far as human sort of related research and whatnot, that will still continue. And that tends to get funded a lot by government agencies for the sake of science, But then there's this trickle down effect to say that, okay, what are technologies that we can develop based off of that? And like I said, I mean, since NASA has been around for all these decades, I mean, there's tons of technologies that have come back to Earth in different forms. And this is how it ends up happening. The government funds for the sake of science, and then a private entity comes and says, oh, we can package this into a product. Right. And then that product ends up getting sold, and then all of a sudden the adoption increases, and now all of a sudden everybody has a smartphone.
Right. So easy question for you, Falgun, because I have several more questions I can get into, but we're already over what I thought we would take. So
this is a long discussion for this.
How can people hear more about you to find out more about this kind of stuff?
Well, as far as me personally, I actually launched my own podcast just a little while ago called Looking Around the Corner. It's on all podcast platforms, on Spotify, Apple Podcasts. I use Anchor.fm to populate it and take and disseminate it. I also have a YouTube channel, which is same thing, Looking Around the Corner. And basically, the whole point of it is to talk to interesting people who are helping to shape our future. And a good portion of those individuals and ideas that I talk about have to do with, are going to have to do with space, because we do see a lot of technology, development and implementation based on those technologies. And plus, it's an area I'm actively interested in. I have a few ideas for ventures in that space, in that quote unquote space as well. And I feel like I think more people need to hear it, because I'm a big proponent of STEM education, especially at a very young age. And I always believe that if you give children the ability to visualize themselves in a particular role or a particular, in a particular manner of speaking for a career, then I think it's very helpful, because now you're training the next generation, to think big. And I don't really think we I don't think it's smart for us to just rely on the Earth, for all that we need, because there are mass extinctions that happen every so many millions of years. More and more evidence coming about that humans had a significant near extinction events even thousands of years ago. So I just feel like we have an opportunity to develop this further, and I think we should.
And if they wanted to reach out to you because they have a space-based idea that they need venture funding on or someone to connect to, how can they reach you?
Yeah, so I don't have my own VC firm or fund necessarily. I do some angel investing, but I think through definitely the podcast have all my contact info. I'm on LinkedIn at Falgun Choksi as well, and I'm on Twitter with my handle as Falgun Choksi MD. So all those ways, I'm pretty social media savvy, I guess, and then so I'm on them. So yeah, if funding wise, it is pretty capital intensive depending on what you're looking for, but NASA actually has a good solid budget for these SBIR and STTR grants, and they will take stuff as pie in the sky as just a concept on a white paper, and to be like, okay, I need help developing this, and they will work with you with the IP and to actually see, okay, is this, can you get a prototype of a particular technology, and then see if you can send it out into space, on the space station for the next few years, or they have partnerships with SpaceX as well. So your product could potentially go on the next SpaceX run or one of the next runs. So some people have done that. Some scientists have done that with different things like looking at fungi and bacteria and whatnot. And then some people do it for material science, to look at different devices, how they react in space. Because there's a huge component that people don't talk about is radiation. The radiation in space is significantly stronger and more harmful to both biological tissues and and non-biological mediums such as semiconductors, circuit boards, these satellites, than it is on Earth. Like we're very fortunate to have our atmosphere and our magnetosphere, but once you start getting out of that area, things get pretty hostile pretty quick. So you need to test out your stuff up there.
So here's what I'm thinking. I think we've talked a lot about research today and commercialization of research. If you're open to coming back, let's have another conversation about actual healthcare and treatment and how patients in space get treated and what are the issues that they face.
Sure.
Would you be open to that? Awesome. Again, thank you for coming on, Falgun. This was
my pleasure.
fun. Thanks again.
Thanks.